Now we're going to talk about hospice care for the person with dementia. The philosophy of hospice is provided comfort care and pain management, no aggressive treatments, radiation, chemotherapy, or multiple hospitalizations when a person has no chance of getting better. Dementia is a terminal illness. A person with any type of dementia will die from the disease or complications of the disease. Occasionally, a person on hospice will improve and will be taken off hospice program. Hospice will begin again when the person gets sick. Let me dive a little bit more into hospice for you so you understand. Back about 10-15 years ago, hospice was a program that was put together for people that had no chance at life, basically somebody who had cancer. Over the years, since we've learned about dementia, Alzheimer's, that was now considered a terminal illness. So hospice came through, which is a Medicare-funded program, and said people with dementia qualify for hospice care. Just because someone gets put on hospice does not mean that we are ending their life. It just means we're providing more comfort, more care, and helping them through the transition. I'm going to go through the steps with you to help you understand what this looks like. The hospice rules. A doctor must believe the person has 6 months less to live. No one knows how long a person will live. So if the person has been on hospice for more than 6 months, he or she can stay on hospice until death, as long as the person is still declining. All hospice programs follow the same rules and give the same care. Hospice is a free program to anyone who has Medicare, and most insurance companies will also pay for hospice care. The hospice team includes a medical doctor, a registered nurse, a social worker, a chaplain, a home health aide, and a volunteer. Now, if you have somebody who is on hospice, again, all of the team members from hospice are separate. They come into our community and they take care of the resident. But that doesn't mean that you or anyone at Rise Paradise is not required to take care of the resident. You have a volunteer, you have a home health aide, which is also a caregiver, and you have a registered nurse. Our job is still to make sure that the resident is well cared for. Even if the caregiver is scheduled to come in from hospice to provide a shower, that means that it is still our responsibility to ensure the shower has occurred. If it doesn't, our staff must still complete the task. The hospice team works with the family in the person's home and works with the associates and the family in the facilities. The facility is still responsible for the care of the resident. Hospice is called when any changes occur with the resident. All new medications must be approved by the hospice and all treatments. Hospice is called when the person dies. Hospice will make all the arrangements after the person dies. Caregiver may call the family if they wish when the person dies, or may wait until hospice arrives for the calls to be made. These are some of the common diseases of dying patients. Cancer is the most common disease group that people die from today. At Rise Paradise, the most common disease group that people die from is dementia. Other illnesses that people die from include end-stage heart disease, congestive heart failure, end-stage lung disease, emphysema, end-stage neurological disease, which is Parkinson's, strokes, end-stage dementia, Alzheimer's, Lewy body dementia. Common physical symptoms when dying. You will notice weakness and being tired, a loss of appetite, weight loss, swallowing difficulty, shortness of breath, and anxiety. Common stages seen in the dying. Several weeks before death, you will notice difficulty swallowing, less urinary output, eating less, no appetite, breathing changes, weight loss, and sleeping more. They're more tired. 1 to 2 weeks before death. Increased fluid in the lungs, more coughing, skin color changes, paler skin or purplish color, sleeping most of the time, no interest in activities or other people, and only eating soft foods or liquids. Days before death. You will see restlessness, eyes half open or glassily far away look, poor urinary output, unable to swallow, sleeping most of the time, no interest in food anymore, mottling of hands and feet. You'll notice purple splotches on the lower extremities and the hands. You'll notice irregular breathing and also increased confusion. Now we have hours before death. Sometimes the residents develop a fever. The brain can't control the temperature anymore. You'll notice gurgling and unable to swallow. Very irregular breathing, may stop breathing for periods of time and then they'll breathe again, off and on. There's no more urine output because there's no fluids being intaked into the body. Hands and feet are cold, the rest of the body is hot. Mottled blue skin and unable to wake up. They're pretty much comatose. Comfort measures at the end of life. Notify the nurse when any of these changes are noticed. You see a decreased appetite. Provide liquids such as shakes or cold, soft foods such as ice cream, jello, pudding, or popsicles. Offer small, frequent snacks instead of large meals. It's okay for the person not to eat or drink anything. Meats and vegetables are usually not wanted. Breathing changes. Elevate the head of the bed slightly. Put a cool washcloth on the forehead of the person. Oxygen may be needed. Breathing will start and stop again. Always keep in mind that when you have changes like this, hospice team will be at the bedside to assist you. The fever. Do not use ice packs or give a cold shower. The body temperature can't control and can't regulate the temperature anymore. It's not regulated by the brain. Just put a cool cloth on the forehead. The nurse may use medication to bring down the temperature. Skin changes. The hands and feet are very cool and the rest of the body's hot. Skin color will change. Again, you'll notice the blue and pale white on the lower extremities and also on the hands. The skin may mottle. Keep a pillow between the legs. Keep heels off the bed. Use boots that totally keep the heels off the bed. This will prevent any skin breakdown. The community associates work with the hospice team to provide comfort care to all the patients, residents, and their families. All changes in condition must be reported to the nurse immediately. Let's take a quick break.